So in part 2 of my Fluids and Electrolytes NCLEX review, we're going to be covering just some basic concepts that you're going to need to know in order for the rest to make sense. So these are just some of the objectives we're going to cover in this video. So the first objective is to discuss how electrolytes are measured, and they're measured in a unit called milliequivalents, also known as MEQ. It's important to know that 1 milliequivalent of any anion will equally react with 1 milliequivalent of any cation or cation. And if we remember the last video we did, anions are negative and cations are positive. One way to remember that is that onions, they make you cry, they're negative, and cations are like cats and positive creatures. This concept is extremely important to understand because we're going to be talking a lot about fluid moving from different compartments. And the compartments can be divided into intracellular fluid, which comprises 70% of the body's total fluid, and this is basically referring to the fluid that's inside the cells. Extracellular fluid is 30% of our body's fluid, and it has 3 subcomponents. 22% is interstitial, 6% is intravascular, so within your veins and arteries, and 2% is transcellular, and this comprises stuff like lymphatic tissue, eyes, synovial joints, and it's basically like another category. Third spacing is basically trapped extracellular fluid that's in an actual or potential body space as a result of a disease or injury. The most important part about this concept is the fact that it's unavailable for normal physiological processes by the body. It's useless. Your body can't use it. And there are some spaces this fluid can be trapped. It's like the pericardial cavity, the pleural cavity, the peritoneal cavity, joint cavities, abdomen, soft tissues, after an accident, stuff like that. Another thing about this is that it's difficult to assess. Typically, by the time you find it, the person is being symptomatic of the actual third spacing. Edema, also known as swelling, is the excess accumulation of fluid in the interstitial space. That's 4 main causes, the first of which is oncotic pressure, which we will discuss later on. It's basically the pull of the proteins in the blood. Hydrostatic pressure, capillary permeability, and lymphatic obstruction. Localized edema occurs as a result of a traumatic injury or surgery. And generalized edema, also known as anasarca, is an excessive accumulation of body in the interstitial space throughout the body, and this is caused by advanced chronic diseases, renal, cardiac, liver failure, and it's a very bad sign. So, body fluid. Body fluids transport nutrients and waste to and from cells. It's basically like the media in which these nutrients are transported through. Proportions of body fluid to intracellular fluid are different depending on what age group you are. 60% of the weight in an adult is body fluid, and this is the most ideal proportion of body fluid to have. In older adults, it's 55%, so they're more sensitive to changes because they have less body fluid to cancel out any shifts in electrolytes. Children, on the other hand, are 80%, and infants, and this is also a risk factor because it's more significant, because if there's a shift in the electrolyte balance of 80% of the infant, it's going to be a bigger impact than there is in the 60% of an adult. And that just shows you how children and older adults are at increased risk of fluid-related disorders. Fluid transport. So there's many ways fluid can transport between compartments. Diffusion is when the solute spreads from high concentration to low concentration. And that's the key word here is solute. The solute is going from high concentration to low concentration. Osmosis. This one is going to be extremely important for us in upcoming slides. Osmotic pressure is the force that draws solvent from a less concentrated solute through a selectively permeable membrane into a more concentrated solute. Basically, it's like this. This diagram is step 1. Here we have a semi-permeable membrane that's permeable to only water, and it's not permeable to solute. If it was permeable to solute, then the solute would just go across to this side and balance out the differential in solutes. But it isn't permeable to solutes, and it's permeable to water. So what's extremely important for this unit for the next few episodes is going to be that water follows the solute. So the water here is going to go all the way over here through this semi-permeable membrane. As you can see, the ratio between water and solutes is going to be equal, and because there's more solutes on this side, there's going to be more water on this side, and that just basically describes the process of osmosis. And a couple other fluid transport types is filtration, which is the movement of solutes and solvents by hydrostatic pressure. And obviously, hydrostatic pressure is when the heart contracts, it creates a higher hydrostatic pressure near the arterial end than the end of the venous end of the capillaries. Basically, it's when your heart squeezes, it creates a higher pressure. This is going to be another extremely important part for understanding fluids and electrolytes for the NCLEX exam. Basically, there are 3 different types of solutions. There's isotonic solutions, meaning both sides of the membrane are in equilibrium and very little osmosis occurs. Basically, if you had a wall, you'd have, say, 5 ions. This is oversimplified, of course, and 5 ions. I have 6 on here, so 6 and 6. This is equal. This is inside the cell, and this is outside. Equal. You can look at it here. Cells are in good shape, just how they should be. Water is moving in and out equally. Hypotonic solutions are solutions that contain a lower amount of solute than another. Typically, the another that they're comparing it to is inside the cell. So hypotonic solutions, here we have our wall. Say we're going to have 4 on the outside of the cell, and we'll have many more on the inside of the cell. And what happens here, remember the first rule, or the most important rule I talked about in the previous slides, is water follows the solutes. So there's more solutes here on the inside, so the water is going to go inside. And if we look over here, we see the exact same thing happening. It's a hypotonic solution, meaning the outside of the cell doesn't have much solutes, so the water and fluids are going to move in towards the cell and go inside the cell, and what happens is the cells swell up, and in some occasions they can even burst. Hypertonic solutions are the opposite of that. So that's when you have more solute on the outside of the cell than you have on the inside of the cell. And what that does, remember, water follows solutes, so water is going to move out of the cell, and as you can see it here, the cells are all shriveled up and water is moving out of the cell. So fluid intake is a big part of this part of the course, and basically the water and fluids can enter the body in 3 major ways. First of which, drinking. Obviously, if you drink a glass of water, it's going to go into the body. Eating, think about foods like celery, which has a lot of water, lots of fruits, watermelon, stuff like that, where if you eat it, you're also absorbing lots of fluid. And the last one is metabolism of foods. So if we go back to our grade 12 or high school education, we'll remember stuff like this. It's not important to memorize this, it's just this is the glycolysis cycle. As you can see, the decomposition of glucose, we have waters being formed, and that's another source of how the body makes fluids. And basically 10 milliliters of water is produced per 100 calories ingested. Fluid loss. What goes in must come out. So fluid exits the body in 3 ways. First of which is kidneys. Kidneys are responsible for excreting stuff from the body. The next of which is insensible loss. This is loss that we don't consciously know that we're losing. So for example, skin. We can sweat through our skin, and that's also creating fluid loss. Every time you breathe out, you're also losing fluid because your lungs need to stay moist in order to facilitate the perfusion of oxygen, and then basically the water just evaporates off. Also, in your GI tract is another place we lose water, sometimes more often than others. Water is secreted into the GI tract in order to loosen up the bowels, but typically it is reabsorbed, but not all of the water can be reabsorbed, so we have another area of loss right here in the GI tract. Sometimes the amount of fluid loss can be more significant than other times. For example, if someone is having diarrhea, then they're obviously going to be losing much more fluid than they would if they weren't. That summarizes basically the most important concepts of fluid and electrolytes for the NCLEX review. Subscribe for more. The next video is going to be about fluid volume deficit, and the one after that is going to be about fluid volume excess.